In this video, you will learn to deal with anxiety, stress, and trauma, and I will tell you 5 techniques professional therapists use to help you overcome them. Trauma prevents us from relating to ourselves and to the external world. In some ways, it's like being a zombie and having our body functioning without really being present in our life. The past can't be changed. There is no way that what happened, no matter how terrible or unfair it was, didn't happen to you, and the reality is that it can't be undone. Yet you are still alive, and the traces that the trauma has left in you tell you that you cannot continue living in this way, in which anguish or depression take over your day, in which the fear of losing or not being able to cope paralyzes you, in which you do not rest or sleep to keep you alert to danger or rejection. In this state, you are not able to open your heart and receive love from another human being because of your immense fear that they will discover how horrible and inadequate you think you are. Life is calling you, but how do you start living? The first step is to recognize that you need help. Although it is true that you are the only responsible for healing, this is a process for which you need support and guidance. In the mental health field, there are many good professionals to turn to, but I explicitly recommend that you look for a professional trained in the area of trauma and post-traumatic stress. They will certainly be able to evaluate you correctly and find the type of therapy that best suits you, which, by the way, does not always include the use of medication. It is necessary that you choose a therapist with whom you establish a deep relationship based on trust, that you feel in a safe, comfortable space, and know that he or she will be there for you. A fundamental part of leaving trauma behind is recognizing traumatic events and realizing how they have affected us. Traditional psychotherapy has focused on having the patient tell their story and relive the event to explain how it relates to how that person feels. But as Dr. Bessel van der Kolk says in his book, The Body Keeps the Score, telling a story about a traumatic event does not guarantee that the traumatic memories come to an end. This is associated to the fact that in trauma, the events that occurred are stored associated to physical sensations, emotions, images, smells, or disturbing sounds, and things are not experienced as facts that begin, develop, and end, but as fragments of what was felt or perceived. Reliving that event makes you feel again exposed to that situation that you could not overcome. That is to say, she feels in the same situation as if it was happening again. Reliving the trauma puts the person in a situation in which the rational part of the brain is deactivated and cannot understand that this is a past event that is over and that today you are no longer in danger. To process a trauma, you have to disconnect the sensations and emotions associated with it and rework the story from beginning to end without the overwhelming burden of what you felt, so that you can rationalize that everything that happened belongs to the past and you are now in a safe environment. Remember that the emotional brain is what drives post-traumatic reactions and expresses them through physical reactions such as rapid heartbeat, shortness of breath, and other similar sensations. The rational brain is not able to suppress emotions, thoughts, or feelings, but it can learn to manage them. I will make now a quick break so you can subscribe to the channel and like the video that will help us to build a community and bring you more content like this. The imbalance that is created in trauma between the rational and emotional brains does not allow us to function properly in life, so the basis of treatment in these cases is the therapy of the limbic system, or emotional brain, making it return to its normal function of keeping us alive. Processing trauma requires to balance this system, and desensitization techniques play a fundamental role in it. Eye movement desensitization, androprocessing, EMDR, is a technique discovered by the American psychologist Francine Shapiro in 1987, and in 2013, it was recommended by the World Health Organization for the treatment of post-traumatic stress disorder. It allows patients to access the memories that triggered the trauma, disconnect them from the emotions, and develop new positive responses that allow to overcome to the negative process that caused them. EMDR is a technique based on the knowledge we have on how the human brain processes negative events of everyday life during sleep in the phase of rapid eye movements, also called REM sleep. The process starts with the therapist following a protocol in which the brain hemispheres are stimulated by reproducing these eye movements, while the patient is awake and fully conscious, trying to evoke the traumatic event and the associated symptoms without necessarily having to say it out loud. In this type of therapy, we look to desensitize people by using the natural mechanism of the brain to eliminate the impact of negative experiences. People with trauma, especially those suffering from developmental trauma, are completely disconnected from their bodies, so learning to connect with your body and emotions in a safe place will open the door to building a new map of yourself. Be willing to explore your inner world. Become an observer of your thoughts, feelings, and reactions. Only then will you learn to manage yourself and become the owner of your actions. Learn to be compassionate with you so you don't overwhelm yourself with anger, shame, or guilt. Every moment is a new opportunity to do better. Learning to be connected with the present moment, interacting with what you have in front of you, centered and calm, are processes that occur progressively and require total commitment on your part. The tools that I will present next require you to be the protagonist of your movie. Number 1. Self-knowledge and mindfulness. Knowing yourself involves learning to observe your thoughts, emotions, and feelings. Also, how you act or react to the events of everyday life. The practice of mindfulness calms the sympathetic nervous system, helps to stay focused on the present moment, and to observe your sensations, thoughts, and emotions without judging them as good or bad, allowing you to manage them without the emotional burden of judgment. On the other hand, it also helps to notice that thoughts and emotions have a beginning and an end. Everything is transitory. Mindfulness is a practice, a continual process. Although it may be hard to do at first, regular mindfulness practice can help you notice your thoughts and learn to take a step back from them. Mindfulness practice can also help you develop more compassion toward yourself and others. You may be less likely to sit in judgment of your thoughts, feelings, and actions. You may become less critical of yourself. Using mindfulness can help you become more aware and gentler in response to your trauma reactions. This is an important step in recovery. Number 2. Managing hyperarousal. Experiencing hyperarousal for extended periods of time causes the brain to prioritize its fight or flight functions, even in situations where we are not in danger. Today, it is known that it is possible to educate our emotional brain to disconnect it from hyperarousal states if we learn to connect with breathing and movement. This is why the practice of activities such as conscious breathing, yoga or tai chi, chanting and dancing drastically reduce hyperarousal symptoms as they involve the brain focusing on physical movement, breathing and meditation. Number 3. Create a support network. Creating secure attachment bonds with people who provide us with physical and emotional security, who accept us, do not criticize us, and do not judge us, allows us to recalibrate our brain tuning system. A functional family, support groups such as Alcoholics Anonymous, spiritual or religious organizations, allow us to learn to trust and that relating to other people is safe. When it is impossible to feel safe with humans, therapies with animals such as cats or horses have shown good results to get out of isolation and disconnection. Number 4. Recovering synchrony. We relate to people with our face, gestures, and touch. Trauma generates fractures in the process of synchronizing ourselves physically and psychologically, so we lose the ability to tune in with our body and with others. Activities such as theater or musical groups, dance groups, and martial arts allow us to learn to work first with our own body and then with the other members. Couples activities such as tango dancing or group activities such as theater teach us to trust and depend on others. They also allow us to learn reciprocity. Rhythm has a powerful healing power. Number 5. Cardio-cerebral coherence. Cardiac coherence is a technique developed by the HeartMath Institute in California, based on scientific research that demonstrates the connection that exists between the brain and the heart. In this research, scientists at the institute have shown that different patterns of cardiac activity have different effects on our thoughts and behaviors. States of cardiac coherence, in which the heart functions harmoniously and regularly, harmonize our physical, mental, emotional, and spiritual systems, producing a state of psychological efficiency in which the nervous, cardiovascular, endocrine, and immune systems function in a coordinated and calm manner. The technique aims to stabilize the heartbeat, reducing the heart rate through conscious breath control, which induces a state of calm that promotes stress reduction, sleep quality, and immune system functioning. In this video, I have shown you some techniques that are available for your recovery from trauma and post-traumatic stress disorder. If you want to keep learning about this topic, leave it in the comments, and we'll plan another series on mental strength.